Hello, my dear friends. Today we will talk about hydrocephalus. To define hydrocephalus, it is a neurological condition caused by the excess accumulation of CSF within the cavities of the brain. So, it happens when there is an imbalance between the CSF production, absorption, or the secretion inside the brain. Now, what is CSF? CSF is a clear, plasma-like fluid that surrounds the central nervous system, occupying the central spinal canal and ventricular system and subarachnoid space. So it is a clear fluid. It has substance such as contents such as the sodium, chloride, protein, WBC, sugar. Production of CSF is 500 ml on a daily basis. And at any point of time, there will be 120 to 150 ml of CSF in our body. CSF is produced in the cerebral ventricles by the choroid plexus and the ependymal cells. So, who produces the CSF? It is produced in the choroid plexus. Choroid plexus produces the CSF and it is transported into the ventricles. Normal CSF pressure ranges from 8 to 15 mm of Hg. Why hydrocephalus occurs? It is because of the imbalance in the production, absorption, or secretion of the CSF inside the brain cavities. So, CSF pathway. CSF is produced in the choroid plexus of the brain. From the choroid plexus of the brain, the CSF is transported into the lateral ventricle. From the lateral ventricle, this is transported into the third ventricle through a narrow channel known as the foramen of Monro. From the third ventricle, it is again transported or the flow is to the fourth ventricle through the channel cerebral aqueduct. From the fourth ventricle, it is transported into the central canal, the other subarachnoid space, the spinal canal. Here the channels are the foramen of Magendie and foramen of Lashka. So this is the CSF pathway. The functions include CSF functions include maintaining the equilibrium inside the brain, that is homeostasis, nutritional supply. All the needed nutrition requirement is fulfilled by the CSF inside the brain, and also it prevent infections happening inside our body. So it has an immune function also. One of the major and foremost function is the buoyant support, and it acts as a protective cushioning. What is buoyant support? Buoyant support means we know that the brain has an average weight of 1.4 kg, but we never felt that we are carrying a weight of 1.4 kg, isn't it? So why we are not feeling it is because of the CSF. The brain is floating inside the CSF so that the actual weight of the brain is not felt on our body. So that is one function, major function of the CSF. Hydrocephalus occurs due to the excessive accumulation of CSF inside the brain. Here you can see a normal CT brain and also how the hydrocephalus CT brain looks like. In hydrocephalus, the ventricles are enlarged, but in normal CT, its appearance is normal. So why the ventricles are enlarged? It is because of the increased CSF production due to any choroid plexus tumor or due to the CSF obstruction due to any tumor or any stenosis inside the pathway, and CSF absorption decreased. Why CSF absorption decreased? Due to any infection such as meningitis, where cerebral edema results in the abnormal functioning of the brain inside the brain. So they can't properly absorb the CSF. So that results in the increased accumulation or excess accumulation of CSF inside the brain. Etiology include congenital cause and acquired cause. Congenital cause, spina bifida, neural tube defect, where CSF pathway, CSF flow is affected. Aqueduct stenosis, stenosis of the aqueduct will cause accumulation above the stenosis. Premature birth complications in the baby. Infections during pregnancy, especially if the mother had an episode or incidence of herpes, rubella during the pregnancy, that will lead to causes such as hydrocephalus in baby. Genetic factors also is a reason. Acquired hydrocephalus causes include the traumatic brain injury, any hemorrhages, tumors, infections such as meningitis, intracranial hemorrhages, where normal equilibrium is affected inside the brain. Types include communicating hydrocephalus, non-communicating hydrocephalus, acquired hydrocephalus, ex vacuo hydrocephalus. Communicating hydrocephalus means the CSF pathway is affected. In all the ventricles, the accumulation or the obstruction and absorption and secretion is affected. So that is communicating hydrocephalus, especially in hemorrhages and all. The presence of blood and the CSF flow is affected in all the cavities because there is no obstruction, only bleeding inside the brain is there. Non-communicating hydrocephalus include in the case of such as aqueduct stenosis, choroidoplex tumors. So due to the tumor, an obstruction is created inside the ventricles, so the normal CSF pathway and flow is affected. It results in the accumulation in any of the cavities. Acquired hydrocephalus after the birth, especially in infections or in any brain hemorrhages after fall, stroke is the reason for the acquired hydrocephalus. Ex vacuo hydrocephalus. Here also stroke, brain hemorrhage, degeneration, all these is a cause. But here the ventricles get enlarges and brain tissue shrinks. It is seen in the MRIs also. Now the symptoms include bulging fontanella, papilledema, increased eye pressure in babies, projectile vomiting will be there, especially once they are awake from the early morning and all. Projectile vomiting will be there in baby. Sunset sign is another unique symptom we notice in infants, that is downward gaze of baby's eyes. Lethargy, irritability, increased mood problems, irritability, cry, decreased appetite, coordination problem, vision problem, headache. All these are the symptoms we see in hydrocephalus. Examination include the muscle strength, reflexes, coordination, balance, their eye movement, their hearing, their vision, their mental functioning and all. And we can measure the head circumference of the baby. If it is increasing, that also suggests a hydrocephalus. Ultrasound for infants. X-rays are also useful in infants to rule out the hydrocephalus. CT, MRI, spinal tap, monitoring intracranial pressure will have fundoscopic examination to rule out the papilledema, which is seen in hydrocephalus. Management include acetazolamide and furosemide, especially to reduce the production from the choroid plexus, and also osmotic diuretics, positioning the baby at an angle of 30° to promote the venous drainage and the CSF drainage. Corticosteroids such as dexamethasone to manage the cerebral swellings. Meningeal signs management with antibiotic, and viral fungal infections are managed with antivirals and antifungals. CSF diversion shunt system includes three types of shunt: ventricular-peritoneal shunt, ventricular-atrial shunt, and lembo-peritoneal shunt. Ventricular-peritoneal shunt means we are diverting the CSF from the ventricles into the peritoneal cavity. From there it is absorbed. Ventricular-atrial shunt, here the CSF is diverted from the ventricles into the right atria of the heart. From there it is circulated and excreted. Lembo-peritoneal shunt, it is here the CSF is diverted from the lumbar region of the spine to the peritoneal cavity, and from there it is absorbed and excreted. Another method includes the endoscopic third ventriculostomy. It is performed when the hydrocephalus is due to an obstruction. It is a minimally invasive procedure where a small opening is created in the floor of the third ventricle so that it allows the CSF fluid to bypass the obstruction and it flow freely. Surgical complication of all the shunt include one of the main and common complication is the shunt malfunction. There is a recurrent admission of patient due to the obstruction causes of the shunt. So we have to then re-explore and we have to put another shunt for proper draining of the CSF. And infection and bleeding is also a complication. Common developmental areas to monitor in child with hydrocephalus are the motor skills, the language skills, the cognitive skills, social and emotional development of the baby, Motor skills include whether the baby is able to roll over, sitting position, crawling positions, their fine motor activities. Language skills such as cooing, babbling, whether they are producing any words. Cognitive skills include problem solving, learning, memory, attention. Social and emotional development, whether they are making eye contact with others, how they are expressing their emotions, how they are interacting with others. And so today we discussed about hydrocephalus. Hope you all got a little bit of idea regarding the hydrocephalus and different types of shunt, how it is managed. Thank you so much, and we will soon see with another video. Please support and see the video and comment on it. Thank you.